This section of the show is called Ask FPA. You can send your questions to tv@fpalex.com and include your name if you'd like for us to use it on the air. Tonight's question is, should I worry about getting the coronavirus? Asked by Frank from Lexington, Kentucky. Here to help me answer that question is my daughter and my partner at Family Practice, Dr. Amanda Foxx. Welcome.
Thank you.
All right, what is the coronavirus and do we really need to worry about it?
Yeah, so coronavirus is a big family of viruses, and we know that a regular coronavirus causes the common cold, and it's just a cold. But then we have these novel coronaviruses that we think mostly start in animals, and then they become viruses that can be in people, and then they become viruses that people can spread between themselves. So this is, in the family of a common cold virus, but it's new, and it's what we see is that it's causing more severe symptoms.
But as of right now, actually more people die from the flu than the coronavirus?
We think right now, yeah.
So in order to keep healthy, there's some things we can do, some general healthy lifestyles.
Yeah, so you want to keep yourself healthy to keep your immune system strong. So so exercising, keeping your stress down, keeping well hydrated, and then also good hygiene, washing your hands, using hand sanitizer if you can, covering your mouth when you cough or sneeze.
Okay, now you mentioned hand washing. Do you just put them under the water, or is there certain ways to wash your hands?
Yeah, so we want you to wet your hands first, turn the tap off, lather your hands up with soap. We want it to take at least 20 seconds, or sing happy birthday twice, then rinse, and then fully dry your hands.
If you don't have soap and water, are the hand sanitizers any good? Do they work?
They are. They're good. They're not good if you have visible soiling on your hands or if you touch something, like a bodily fluid. And we want the hand sanitizer to have at least 60% alcohol in it.
Okay. What about other things like masks? Are they important?
So masks are more important for people who are sick. They need to wear a mask to try to prevent spread. It's important for healthcare workers to wear masks. For the general public, we don't really know. It may not be that useful to wear a mask for prevention.
How about disinfectants? Do viruses live on tables and door handles?
They can, but they don't live for a super long time, but it's always a good idea to disinfect things. Good old soap and water will work pretty well. In healthcare settings, we use kind of stronger chemicals.
Bleach or Lysol any good?
Bleach is always a good idea, can be irritating to people, can dry your skin out. You certainly want to dilute it if you're going to use that.
Okay. Are air cleaners helpful?
So air cleaners have shown to kind of decrease the amount of allergens in the air, so they're not a bad idea.
How about vitamins? We hear a lot about vitamins. Are there any preventive things you can take to keep from getting sick?
Yeah, so again, that's just really getting good nutrition from the food that you eat versus taking a multivitamin for prevention. There are things like elderberry and vitamin C that people like to get off the counter, and we don't have a lot of science behind that, but it's probably not going to hurt you.
But ultimately, immunizations.
Yeah, so as probably most people know, we don't have an immunization for coronavirus, but we certainly have an immunization for the flu and some other viruses that are out there.
That's right. And here's a short video by Baptist Health about immunizations.
A vaccine is typically an injection that increases your immune system ability to fight a disease. It makes your immune system remember something, so then if it sees it again, it can fight it. Most of the vaccines that we give are actually dead viruses. They are not going to give you the virus. They are very safe. We have done study after study on thousands of children to adults to be able to have these approved for the FDA. There are lots of different types of vaccines for all different ages, from birth all the way up until age 65. And then kind of periodically recurring things like flu shots. And we want to get them done right when we recommend them because we want to give as much prevention as we can. So having an annual regular checkup is one of the most important things to be able to have your preventative care up to date, and immunizations or vaccines are part of that regular checkup. We want to think about herd immunity even within your house. We don't want things spreading. We think of the flu. We have flu epidemics every winter, and we just don't want things that are more serious that we don't have treatments for that would spread rapidly and cause illness all over the country. You don't want to be a person with a suppressed immune system if we had a measles outbreaks or if we have the whooping cough outbreak, for example. And you also don't want to be patient zero, the person who started it all over the country.